Hello everyone, glad to join you all in this World Breastfeeding Week to raise awareness and galvanize action on themes related to breastfeeding. It was started in 1992 with annual themes including healthcare systems, women and work, the International Code of Marketing of Breast Milk Substitutes, community support, ecology, economy with the Sustainable Development Goals. So this year, the World Alliance for Breastfeeding Action, that is the WABA, come up with a theme is Closing the Gap, Breastfeeding Support for All, which is marketed in over 120 countries from August 1 to August 7. Today, our beloved Dr. Azuma, lecturer cum medical officer from the Department of Community Medicine, delivering the talk on empowering mothers, government incentives and supporting schemes. Over to you, Doctor.
Start now. Good morning to one and all present here, gathered for this webinar. And today I'll be talking on the topic Empowering Mothers, illustrating and explaining the government incentive schemes and the support schemes. So what is empowerment? Empowerment in simple terms is to give somebody the autonomy and the power and authority to do something. So empowerment is a degree of autonomy and self-determination in people and communities, and it is often given to people who are lacking an equal share of resources to gain greater access and to control over those resources. Empowerment in health is for individuals to gain increased control over factors that influence their health status. It is done to empower individuals and to obtain more equity in health, and it is also important to address health-related behaviors. Why should we empower mothers? Because mothers are a point of social change. They determine the health of a family, of the next generation, as well as those that influence the society on the whole. So how can we empower mothers? We can empower mothers through bridging the knowledge gap and giving them an early and easy access to healthcare, financial assistance, and legal support through legislature. So in antenatal care, every Tuesdays at primary healthcare centers, antenatal clinics are present, and the components of antenatal care include antenatal visits, prenatal advice, specific health protection against certain communicable and non-communicable diseases, mental preparedness, family planning concepts, and pediatric component of attending the children accompanying the pregnant mother. Next, our government has come up with a software called Pregnancy Pick Me, a pregnancy and infant cohort monitoring evaluation. The target are all citizens residing in Tamil Nadu, both in rural and urban area of the entire state of Tamil Nadu. So this web portal captures the details of pregnant women starting from eligible couple registration to till 16 years of the child through the village health nurse or urban health nurse. And each mother is given a unique ID called RHID. So the government of Tamil Nadu has made it compulsory to register all the pregnancies in this system, and the birth certificate will be issued only if RHID is available with the mother. Using this number, the details of the mother can be viewed at any level. Emergency Management Research Institutes and 108 ambulance services have also been given the login ID using this PICME so that they can take the list of all the EDD mothers from the system and call the mothers to give a pickup service to the mothers to the hospitals for delivery. This software is also linked with the birth and death registration software. This detail is also is entered in the software and also determines the eligibility status of a mother to the Dr. Muthulakshmi Reddy Maternity Benefit Scheme. PICME 3.0 version enables self-registration for RHID through mobile phones. So now it is easier for mothers to register themselves after they have confirmed their pregnancy, and therefore it also paves the way for sharing of the line list through PICME with the Integrated Child Development Services Scheme for monitoring of babies discharged from the special newborn care units as well. Also, the mother is given a mother and child protection card. Next slide. Which contains details regarding the health status of mother, antenatal care visits, the histories taken, and the basic information and danger signs to be followed and cautioned for a mother. And after the details of the delivery and postnatal care delivery details are present in this card. It also contains information regarding the birth, the growth chart, as well as immunization chart for the infant. It also contains details regarding the family planning advice. Also contains developmental milestones and danger signs at every interval for mother to follow and reach out to medical help when needed. So next is a baby-friendly hospital initiative. So this is an initiative established in India to assist mothers in locating the breastfeeding-friendly facilities before giving delivery. This is a certification program that allows hospitals to earn a breastfeeding friendly label. So in this program, the hospitals are equipped to sensitize the mothers on the proper breastfeeding practices. So this has developed the 10 steps for successful breastfeeding, including hospital policies, staff competency, antenatal care, care right after birth, support mothers with breastfeeding, responsive feeding, bottle, teats, regulation regarding bottles, teats and pacifiers, and discharges. So other programs include Janani Suraksha Yojana, Janani Shishu Suraksha Karyakram, Anemia Mukt Bharat Scheme, High Risk Mother Observation, PICME Portal, Nutrition Rehab Centers, Muthulakshmi Reddy, Dr. Muthulakshmi Reddy Maternity Benefit Scheme, and RMNCH+A programs. So Dr. Muthulakshmi Reddy Maternity Benefit Scheme is a financial assistance provided to poor pregnant women or mother to meet the expenses on nutritional diet, to compensate the loss of income during the motherhood, and to avoid the low birth weight of newborn babies. And it is aimed at reducing the infant mortality rate and maternal mortality ratio. The objective is to provide assistance, and the target is all the below poverty line pregnant women. So the eligibility to obtain assistance under the scheme, the pregnant mother should be above the age 19. They should certify their economic status in the PICME portal. Mothers who are delivering in the private medical colleges approved under the scheme are also eligible after ensuring the provision of free delivery services, including cesarean deliveries. Sri Lankan refugee pregnant women are also eligible. Pregnant women who are members of Farmer Security Scheme are also eligible to get this cash assistance. This is only given for first 2 deliveries. However, certain conditionalities, HOB mothers are also eligible for the first and 5th installments, and also for the 2 nutritional kits. Migrant mothers from other states working in bricklines, quarries, roadworks, construction sites, and other infrastructure development projects are also eligible, and they are eligible for the 1st and 5th installments and the nutritional kits only. So assistance given under this scheme are given in 5 installments and 2 kind benefits. In first installment is given right after the antenatal registration or on or before 12th week, and the amount given is 2,000. And along with this, a first nutritional kit on completion of 3rd month is given. Second benefit is given after 4 months, subject to certain conditions mentioned in the GO, which is 2,000 rupees, and a second nutritional kit is also provided. The third scheme, the 3rd installment gives 4,000 rupees, and the 5th installment totaling up to 18,000 rupees. The Pradhan Mantri Matru Vandana Yojana is a scheme from the center In this scheme, 60 to 40% sharing pattern is between the central and state. It's for all the eligible pregnant and lactating mother for the first child. In Tamil Nadu, the government of Tamil Nadu has decided to give it along with the Dr. Muthulakshmi Reddy maternity benefit scheme for the eligible primary mothers. So for this co-branded PMMVW, MV and MRMBS, the target women are all eligible pregnant women. The maternity benefit is for primary gravidate mothers. 8,000 rupees are payable in 3 installments under the Pradhan Mantri Matru Vandana Yojana, and the remaining installments 3 and 5 are given under the Dr. Muthulakshmi Reddy maternity benefit scheme. Janani Suraksha Yojana is a safe motherhood intervention under the National Health Mission. It is being implemented with the objective of reducing the maternal neonatal mortality rate by promoting institutional delivery among poor pregnant women. It is a centrally sponsored scheme, and this scheme has identified accredited social health activists, that is ASHA, as an effective link between the government and the pregnant woman. So under this scheme, the states of the India are classified as low performing states and high performing states, and accordingly cash assistance are given for pregnant mother. And for institutional deliveries, they are categorized under low performing and high performing states, and based on their residing area in rural and urban area, their packages are determined. Janani Sishu Suraksha Karyakram entitles absolutely free and no expense delivery, including cesarean section, including free drugs and consumables, free diagnostics, free blood whenever required, and free diet for 3 days during the normal delivery and 7 days for C-section. This initiative also provides for free transport from home to institution between facilities in case of a referral and drop back home. And after 2014, it was extended to all the antenatal and postnatal complications in pregnancy. And similar entitlements are given for all the sick newborns and infants up to 1 year of age. Maternity Benefit Amendment Act is a legislature that protects the rights of a woman for employment. It entitles her for a maternity benefit, that is for a full paid absence from work to take care of the child. This act is applicable to all the establishment employing 10 or more than 10 persons in factories, mines, plantations, shops and establishments and other entities. The eligibility for this act is the mother should be working as an employee in an establishment for a period of at least 80 days within the past 12 months. So under this scheme, we have under this legislature, we have increased paid maternity leave up to 26 weeks. In the earlier it was for 12 weeks, and after the amendment in 2017, it has extended up to 26 weeks. This could be availed by a woman for a period extending up to maximum 8 weeks before the expected delivery date, and the remaining time can be availed after the childbirth. This is applicable for the first 2 pregnancies only. For women who are having 2 or more surviving children, the duration of paid maternity leave shall be 12 weeks, that is 6 weeks before and 6 weeks after the EDD. It also gives maternity leave for mother who are adopting children below age of 3 months and for commissioning mothers. Commissioning mothers are defined as biological mother who uses her egg to create an embryo planted in any other woman. Work from home options. This enable provisions which can be exercised after the expiry of 26-week paid maternity leave. Depending upon the nature of work, the women employees may be able to avail this benefit on terms that are mutually agreed with the employer. Creche facility. This act makes creche facility mandatory for every establishment employing 50 or more employees. Women employees will be permitted to visit the creche 4 times during the day, including rest intervals. And where the creche facilities are not available, the women employee, there should be 2 1/2-hour rest periods. A creche is a facility that enables parents to leave their children while they are at work, and where the children are provided stimulating environment for their holistic development. Creches are designed to provide group care to children, usually up to 6 years of age, who need care, guidance, and supervision away from their homes during the day. And under this act, it is mandatory for the employers to educate women about the maternity benefits available to them at the time of their appointment. The next legislature that protects the rights of mother and child are National Guidelines on Infant Young Child Feeding, the Infant Milk Substitutes, Feeding Bottles and Infant Food Regulation of Production, Supply and Distribution Act of 1992. It came into force in 1993 and later it was amended in 2003. It prohibits the promotion of infant food, infant milk substitutes, feeding bottles, and the GOI is committed to promote breastfeeding through these practices. Under this act, if any person promotes any food by whatever means is for children up to 2 years of age, and because of this act is the reason why we don't find TV advertisements or social media advertisements that regulate that show regarding advertisements for infant formulas, breastfeeding formulas, and other supplementary feeding programs. Next slide. Next slide. So to sum up whatever we have covered, we empower mothers through giving an early and easy access to healthcare and by bridging the knowledge gap through the Mother and Child Protection Card, free antenatal care visits at PHCs, the Pick Me portal, the Mother and Child Protection Card, giving all the details regarding the do's and don'ts during the pregnancy, lactation, and the care of infant up to 1 year of age. Next. And we give financial assistance and through government health programs such as Muthulakshmi Reddy Benefit Scheme, Pradhan Mantri Matru Vandana Yojana, Anemia Mukt Bharat Scheme, under which pregnant women and lactating women are given iron and folic acid tablets, Janani Suraksha Yojana, and Janani Shishu Suraksha Karyakram. We also empower mothers through legislature with the Maternity Benefit Amendment Act of 2017 and the Infant Milk Substitute Act 2003. And the women are also given helpline numbers such as 102 for ambulance and 102 for hospital on wheels. Thank you.
Thank you, Dr. Asuma, for giving us highlights on all the schemes which has been released by our Government of India. Thank you so much. All of you, our YouTube viewers, stay tuned for our upcoming talks in our Breastfeeding Week awareness programs. Thank you. Thank you so much.